Alright, I'm going to make this very clear. People are saying that others are fear-mongering because long COVID is a problem. And then we have the media saying long COVID doesn't exist. This is gaslighting, right? Because COVID does have serious effects. So I'm going to make this very clear. When people say that, oh, I am fear-mongering, or stop this fear, we can't live in fear. We've lived with viruses forever and ever. The point is that viruses can damage your immune system, right? For example, measles and HIV. I can just name these two examples, and already you can't generalize that you can get immunity. And when I say immunity, I mean that the body produces antibodies to the pathogen that you've been infected with. So in a sense, are people immune to the HIV virus? Well, if your body does make antibodies to the HIV virus, does that mean that you're immune? Well, I suppose you can be immune, although slowly the HIV virus will kill your T cells. Okay, so why do people wear gloves? Right? Is it because people are afraid of getting burnt? I mean, I wear gloves to handle hot things or dangerous substances. So why do people wear gloves? Are they afraid? Why do people wear seatbelts? Well, when people are traveling at maybe 70 miles per hour and there may be an accident, the seatbelt can save your life. Are you afraid of being in a car crash? Why do people wear safety goggles? Why do people use an umbrella? Why do people wear helmets? And also, people have been wearing masks before the pandemic, before the ongoing pandemic. Yes, people have been wearing masks. Right, let's talk about the recent events from the last 2 days, right? Bird flu. By the way, COVID is still here. It is still going on. And let me just repeat to you again that when people are saying that we can't live in fear, we have to live our lives, that is just gaslighting, because we are seeing an increase in measles and TB. It's not over, it's still here, and we are mitigating, right? Now, the point of human society is that we study science, we study things, we investigate. Once we learn from our investigation and research, we try to implement new strategies, right? New discoveries, new viruses, new pathogens. I'm talking about biology now. We need to mitigate against these pathogens that can kill us, right? Think about self-preservation. I don't want to die. People don't want to die. I want to live. I don't want to get harmed. I don't want to harm other people. We have to protect people. That is what society is about. We need to protect people. This is what humanity is about, right? There is no you do you whenever we have a pandemic. Right, we do not risk people's lives for the sake of normality. And what does it mean by normality? We have introduced a new pathogen into the human population. So by definition, logically, we are not living in normal times. Right, there is now COVID, there is now SARS-CoV-2 virus in the human population. By definition, this wasn't in the human population before 2019. So we are not living in normal times because now we have COVID. Right, I've just got this from today. Right, there is now H1. Wait, that should be H5. That should be H5N1. Anyway, the point is there is bird flu happening. I've already said this for months and months. Right, bird flu has been happening for years now. Maybe 1 year, at least a year. Right, we have an individual in the US having caught bird flu from a cow. And we have seen news reports that the bird flu is happening in cattle and is being tested. So bird flu is spreading among dairy cows in at least 3 states. 3 states. 2 hours ago, this is today. Well, this is today, but I knew about this yesterday. Right, so bird flu patient marks concerning spread in the virus spread. Are you saying now this is fear mongering? So because this is happening, we shouldn't be reporting this in the news. This is happening. We need to be evaluating what's happening. We need to be certain it doesn't cause any problems. Now, let's just say you don't care about people's health, right? Let's just assume that you don't care about people's health, but let's just talk about the economy. Okay, well, if the cattle manages to get bird flu and it spreads among cattle, what if they die and the beef industry, the agricultural industry starts to fall apart? Who's to blame there? Right. So Texas person diagnosed with bird flu. Australia tracking outbreak of avian flu in US cows. Yes. Now, this has been happening for weeks and weeks, months and months. Bird flu found in king penguins for the first time on islands. This is 3 weeks ago. Right. Now, if you just remember BSE, right? The BSE scandal. It took many years for them to acknowledge a problem with BSE, right? They denied the link between BSE and variant CJD. It's affecting ecosystems, right? So let me just talk about the gaslighting here, right? People are saying masks don't work. We can't hold on forever. We can't keep living in fear. We have to live our lives. We can't put our lives on hold. We have to live our lives. I hate masks. Now, if we just Google search, and then you're going to say, oh, Google is just like nonsense, right? But there are peer-reviewed studies from research, from universities, that COVID does harm the brain. But then you say, well, not many people are harmed. People have been getting COVID and it's just like the flu. Now, let me just tell you that Alzheimer's, we don't know what causes Alzheimer's. It takes decades for Alzheimer's to show. Like, let's just say let's say you have memory problems. It takes decades for it to show. It's only been about 4 years, right? When I say it's only been about 4 years, it's only been about 4 years. People are still not mitigating against this disease, right? There is research that shows that the damage done by COVID on the brain, to the heart, right? This is from Nature, right? Nature 2024, March 20th. New research adds to the evidence that inflammation in the brain might underlie these symptoms. Of course, not all data points in the same direction. The point is, COVID is a multi-system disease. It affects, now it's to do with the ACE2 receptors. Now, I'm going to talk about the precautionary principle. There is already so much damage done by COVID that we are not mitigating, but we still think that COVID is the common flu. Where is the evidence that COVID is the common flu? This is just hubris. Why am I wearing a mask? Well, I don't know the long-term effects, but we've seen the damage from the short term. The precautionary principle, right? The precautionary principle is a modern restatement of the Hippocratic Oath. Do no harm. I will keep them from harm and injustice. I don't know what's going to happen in the long term. I will try to minimize the risk. Okay, so however, the precautionary principle is more than just individual actions. It's to guide institutions and nations, right? It is, it is not like the Hippocratic Oath, because Hippocratic Oath is mainly for doctors, do no harm, but it applies to humans and environmental health. The precautionary principle. We have seen in history that that governments have been lying to us, or just they don't know until they wait for further evidence. They assume that they're doing it for the benefit of the economy, but they don't know. But they still going through their mistakes, right? I'll give you some examples later. So this was in 2020. COVID associated with psychotic disorder, delirium in older patients with COVID-19. This happened in the early stages of the ongoing pandemic. People were suffering from psychosis, loss of smell and taste. Already, I knew that was a problem because those are symptoms of Parkinson's disease, and Parkinson's is a neurological illness. Right. Let's just talk about the problems right now. Sewage. We are damaging the environment. Sewage. Climate change. Nothing is happening on climate change. We are still ignoring it. COVID, we are ignoring it. Lack of mitigations. We are spreading illnesses everywhere, and we don't care, right? People coughing, they don't care about the spread of illnesses, and then the delusion of going back to normality. But again, this is just logic. You can't go back to 2019 because we have introduced a new pathogen into society. So we can't go back to 2019. We need to adapt. We can't assume we can go back to normality, right? Okay, so let's look at A&E now. I've said this countless times. We need to reduce any medical problems. NHS. The NHS is in deep trouble. Why? The public is believing that COVID is harmless, but we are damaging the NHS. Long A&E wait times, more than 250 deaths each week. Let's assume that this isn't happening. Let's just assume that this is all fake news. But have you not noticed that people are getting more ill? Even in real life, people are getting more ill. People are coughing more regularly. I have seen this. People are coughing. If you go in the shops, if you go on the tube, people are coughing and they don't cover their mouth, right? This is a problem, and this is what they want you to believe, right? They want you to believe that COVID is harmless, but then these people are spreading COVID and they are getting more ill, and then this is ironically the survival of the fittest, right? Think about the rich people. The rich people know what they're doing because they have enough money to buy HEPA filters. They have enough money to ventilate their buildings, indoor buildings. They don't care about the poor and the weak. This is from Twitter now. As a virologist, getting twitchy again reading about the observations of H5N1 in cattle. Reminder, about 60% of people who have been infected have died from it. Now, there was news in Vietnam. A person has died from bird flu that he received from in contact with cows. Here it is. Vietnam confirms H5N1 in man's avian flu death. Right, flu death strikes Vietnam. 1 death. Are we supposed to be concerned about this? Yes, we should be. It's just 1 death. The problem is, in an ongoing pandemic, no one is being aware of this, right? No one is being aware because mitigations are not happening, and so these things are happening because we aren't reducing risk. I've seen this before, right? This is from Twitter again. Why SARS-CoV-2 elicits mild symptoms at first, but then for a subset of patients turns potentially fatal a week or so after infection. This is from Twitter again. A relative just passed due to COVID March the 30th, about 3 days ago. No masking from NHS staff. Coughing unmasked whilst dealing with her. Right, now there's an increase in cancer. Let's assume that it is not made worse by COVID. Let's assume that it is because people aren't going to hospitals, they aren't getting diagnosed. But first, what is causing that cancer then? What is causing this cancer? I want you to think about what is causing this cancer. The elephant in the room is COVID. Let me just tell you what a virus actually does, right? A virus actually goes into a cell, makes more of itself, and it just makes more of itself, right? It needs a cell to replicate. A virus needs a host to replicate. And it just causes inflammation because your body recognizes the foreign pathogen in your body, and so your immune system will be activated. But have you not noticed that many viruses cause cancer? Many viruses cause cancer, and we are ignoring the real problem here. Let's talk about the problems, right? So before, doctors used to think that smoking was good for you. Have a look, physicians, a healthy cigar. Many doctors smoke Camels, right? Than any other cigarette. Mad cow disease. HIV and AIDS. We didn't know what HIV was, and then we knew that it causes AIDS, but then it took decades to realize that. Climate change. These are things that have happened in history, and then using history to inform us of what's happening now. We are being clouded by the unknown, and so people think that, oh, we don't know what's happening, but we should carry on with our lives anyway. But the thing is, it is actually affecting the economy because lots of people are getting ill. We are not doing anything about it. Let's talk about this, right? Sewage. I got this on the 30th of March, 6 p.m. Oxford rower complains about too much poo in the water. Right. The Tories want you to spread illness. They want to damage the NHS basically. They want you to spread illness because there's profit in illness. If you get ill, you buy paracetamol, you buy these drugs. Guess who benefits? The pharmaceutical companies. There is no profit in being healthy. If you're healthy, you don't need to get drugs. This is capitalism, right? The survival of the fittest, the capitalist model of economics, right? There is no profit in illness. So if you're healthy, then that's fine, that's good, but that's good, right? It is good that you're healthy. It is bad that you are ill and you need medications, you need drugs to get better. Right, let's just go back to the dumping, right? Dumping of sewage. They are dumping sewage into lakes and rivers and oceans. This is not a civilized society. Think about this. Do we really want our society to be like that? To be like this? Right, let's go back to COVID. Yeah, I know I'm jumping place to place. Because all of this is linked. All of this is linked, right? March the 20th, 2024. COVID's toll on the brain. Now, let me just go back to Alzheimer's, right? It takes decades for Alzheimer's to show. And it's already been 4 years. And new research adds to the evidence that inflammation in the brain might underlie these symptoms. So, okay, so we don't know what's going on. But we think that COVID is like the common cold and we are just spreading it to the population. We don't know what's going on, but we think it is like the common cold, right? We are still researching what's going on, but we're still spreading the illness. We're still spreading COVID as though it is the common cold. Do we not have the intelligence to learn from our mistakes and reduce the spread of COVID? So bird flu infects penguins. Penguins fear global spread, and it's happening already. Brain fog. Mounting evidence shows that COVID-19 leaves its mark. I'll show this already. Right, so this is brain fog, right? Many others may experience brain fog for several months or longer. If you think that COVID is like the flu, well, it is not. It is not. Don't be gaslit. Right. COVID linked to lower IQ, poor memory, brain temperature, and free water increases after mild COVID-19 infection. I can give you more and more peer-reviewed studies if you wish, right? Peer-reviewed studies, but then your argument might be, well, if it's really bad news, why isn't the media saying about this? Now, let me tell you that the BBC is now owned by the Tories. Sky News is probably better than the BBC right now. And I mean, it is also to do with public perception. We don't want to keep talking about COVID. I mean, I do, because there's always new discoveries every day, every week. Many people think that, oh, it's so boring. Oh, can we stop talking about COVID? Unfortunately, COVID is mutating, right? We had Alpha, we had Delta, we had the Omicron variant, and then you're going to say, oh, but we have adapted to the virus now. We need to live with the virus. Are you serious? Are you absolutely serious? Not many people get the flu, and I mean, okay, so not many people get the flu regularly, not even once a year, and flu is quite deadly. Flu is quite harmful. COVID, on the other hand, there was 1 year where there were hospitalizations 5 times a year. Right, so COVID-19 leaves its mark on the brain. Right, this is from Scientific American, Science News, even from people, right? I mean, I know this is from the media. Right, let's look at Medscape. New evidence suggests long COVID could be a brain injury 1 month ago. Oh, but then you're gonna say, oh, these are all lies. Okay, fine, these are all lies. COVID linked to lower IQ, poor memory, and brain aging. March 26th, 2024. So here it just talks about COVID-19 linked to lower IQ, poor memory, and brain aging. Do you care about that? Just the media. These are all lies. Let's just live our lives and just ignore this piece of evidence. In a study published in the New England Journal of Medicine, researchers detailed the numerous previous studies that highlight what they describe as the indelible mark that COVID leaves on the brain and its functioning. Let me just go back to the beginning of the pandemic, right? People had suffered from delirium, psychosis, loss of smell and taste, lung problems, right? People were suffering from lung problems, and although there was, because of the mutation of Omicron, the first symptom wasn't breathlessness anymore. I mean, you still get fever. However, let me just go back to the asymptomatic spread. These days, you can still get COVID and not get a fever. Yes. One month ago, 3 weeks ago, right? Brain fog, leaky vessels, vascular leaks. Cause of long COVID brain fog could be from leaky blood. There is no good news here. There is no good news coming from COVID. Tell me, name me one good news about COVID. Oh, because people are okay now. After getting the first bout of COVID, you seem fine. You're okay. It's just like the common cold. You're okay now. I mean, I had COVID 2 years ago. This is not me. I had COVID 2 years ago, and I was fine. I'm fine now. Really. The reason why I say that, because again, we don't know what causes Alzheimer's, and common pathogens can lead to Alzheimer's, like flu and pneumonia. We don't know what causes Alzheimer's. Now, Alzheimer's is a huge problem, and Alzheimer's is increasing, right? There's, over time, because of the population is increasing, there will be more Alzheimer's. We don't know what's causing it. We don't know the long-term effects, but we think that COVID is like the common cold. COVID-19 brings down life expectancy. It is increasing in global inequality. We talked about this before. Yep. So we've seen this before. So I'm just gonna tell you that the NHS is being brought down by the Tories because the public is believing that COVID is like the common cold, but we are still trying to figure out what it actually does. Let's talk about HIV. We haven't found a vaccine for it. There's no cure for HIV. The thing is, you're probably asking, why am I making these comparisons with HIV and COVID? Now, there are some studies that suggest that there is immune dysfunction once you get COVID, and I'll tell you why. Because now there is more TB, and there are more measles, and there's more strep. But then you say also because of lockdown and immunity debt. Are you really serious? You're trying to argue that because of immunity debt there is now an increase in measles, TB and strep because we haven't been exposed to those viruses. Alright, so you're saying that because of lockdown we are not immune to these viruses. Now, let me just tell you, obviously, you're talking about anecdotes, right? Where's the data? Many people have, before the pandemic, have been absent from school, maybe because they had an operation, they were away from school for more than a month, and they have managed to catch up. Oh, and by the way, there is an increase in mental illness. The elephant in the room is obviously COVID, because it is still an ongoing pandemic. The point I'm trying to make here is that we are assuming that COVID is like the common cold, but we are seeing negative reports of COVID. It's all negative. Nothing is beneficial. And then you're saying, oh, you've just had the vaccine. You just had the vaccine, we'll be okay. Yeah, but constantly being ill is not good for you. For one thing, your body will be inflamed, and inflammation is just bad for you, right? If you're constantly ill, just like getting the common cold, and you're constantly getting flu, you're constantly getting all these common illnesses, and you're thinking that you have become immune to it, you are still being ill. There is inflammation in the body. You are still being harmed. You are still being damaged internally. There is nothing good about being unhealthy, and that's just logical. Just looking at that sentence logically, there is nothing good about being ill, because your body is being inflamed. Your body is trying to repair itself, and your body needs to heal. Constantly getting reinfected with COVID is just bad for you, logically. And empirically, it is not good for you, because you're being inflamed. Your body is trying to reduce the inflammation, and if you're constantly being inflamed, that is just bad. And I don't know how I can get that across to you. I don't know how I can get that across to you.